Hello. Today I will be presenting over Alzheimer's disease. And before I begin, if we're in a face-to-face setting, I would ask my audience, which would be my classmates and my instructors, what they already know about the disease. I want to kind of get a background. I want to have background knowledge of what they know of the disease, just to see if they know that there's four different stages, if they know all the symptoms at different stages. Because many people get Alzheimer's confused with dementia or just memory loss in general. And I'm hoping that at the end of my presentation, I'm able to provide some sort of clarity and educate you on the differences on each stage and the symptoms that are prevalent with them. Um, Alzheimer's. Um, the first sign of Alzheimer's is usually memory loss, which is caused by cognitive impairment, and it usually starts with a brain deterioration, and brain damage can occur up to a decade or even further before they're actually diagnosed with Alzheimer's and before the symptoms even show up. So they may have had brain damage in the past, and then it's just taking a long time for the effects to show up. Other common problems associated with Alzheimer's are vascular degeneration, which causes loss of blood to the brain. Don't know why I pointed, but it causes a loss of blood, which would not provide the brain tissue with enough glucose to function because your brain occupies 2 to 4% of your body's mass, but it uses over 20% of the energy in your entire body because it's running the whole thing. So without that blood, oxygen levels, and glucose levels, the brain actually deteriorates, and sometimes it can shrink well up to a third of its size. I have had the opportunity to examine that firsthand, a healthy brain compared to a brain that was subjected to Alzheimer's disease, and it was just eerie to see the brain shrunken. It looked like it belonged to an underdeveloped, like it looked like it belonged to a younger person, not someone who lived to be 80 something years old. Um, people, physicians can only diagnose Alzheimer's after death because you can't diagnose it until you have an autopsy performed where you can actually see the deterioration of the brain. But the physical examination of the brain, along with the clinical data that you have um, collected over the however long the duration of this patient having Alzheimer's is. Both of those together allows the physician to make a proper diagnosis. Earlier on, there's four stages. Preclinical is the first one, and in that stage, some of the patients may be diagnosed with a mild cognitive impairment, which is associated with memory loss, and but it's different than Alzheimer's because with mild cognitive impairment or MCI, there's no personality changes. It's just a loss of memory, difficulty finding words or items, misplacing things. There's no like aggression or any other drastic um, symptoms associated with mild cognitive impairment. And I want to say as a disclaimer, none of these are a normal part of aging. Alzheimer's, dementia, mild cognitive impairment, they are not normal within the aging process, but they have a higher risk factor for the elderly patients because of like lack of exercise, diet, environmental factors, lifestyle choices, and so on. That just makes them more susceptible to it at an increased age of 65 and older. Um, the first stage is preclinical, and that's the first stage of Alzheimer's. That's whenever you may experience like um, not confusion, but just loss of memory, trying to find words that they just don't know what to say. Um, Not too many symptoms are prevalent there, but the next stage is mild. They have trouble mild stage of Alzheimer's. Patients have trouble making sense of the world around them. Uh, they realize that something is wrong, and that realization can mess with them even more because they realize that they're not who they once were. That's currently happening with a member of my family. He realizes that there's an issue going on, but he knows that he can't do anything about it. And that's often humiliating and just stressful and induces anxiety within patients with Alzheimer's because they know that there's something wrong with them. They're not oblivious to that, and they know that there's not much that can be done because Alzheimer's, there's treatment options, but there's no cure for it. Once it's detected, it just has to run its course. But there's treatment options to delay it. Problems associated with mild stages of Alzheimer's are poor judgment, loss of spontaneity and initiative, longer time to complete activities of daily living. Just ADLs, just they're slower. They don't have a fast reaction time. Memory loss is associated with mild as well. Wandering, getting lost, and you may also experience mood and personality changes, which can lead to aggression later on. A nursing intervention at this stage would be to combat disturbed thought processes. You can assess the patient's ability for thought processing every shift. You can assess for confusion and disorientation. You may have to orient them to the time and place and location that they are at. Um, you can orient them by using pictures, TV, radio, newspapers, anything that may give them a sense of familiarity with what is going on in real time. And since they are understanding of the disease, then you can try to provide some ways for them to cope with it. The next stage is moderate um, Alzheimer's disease. Um, More intensive supervision and care are becoming necessary because as the disease progresses, um, so does brain deterioration and so does memory loss, confusion. They will be more aggressive usually because they have trouble remembering who people are, and if you try to help them, they may show signs of aggression um, or just distrust almost. They have a difficulty recognizing family and friends, and it it's difficult for everyone to get used to that because you've known them, they've known you your whole life, but they just can't remember because starting in the hippocampus, which is where reasoning, mathematics, and learning and memory functions are held, that's where the brain deterioration starts from. And then it just expands, and then total memory loss as the disease progresses. Um, Nursing intervention here would be for self-care deficit, grooming, and dressing. Um, Within the mild stages, they should be able to still complete ADLs. They just may take longer. So, like getting dressed, eating, brushing their teeth, bathing themselves, that should still be something that they're able to do on their own. But in the moderate stage, you will have to assist them getting dressed, which having loose fitting clothing to put on would be easier if they are not able to help them themselves, and assess the patient's ability cognitively and functionally every shift just to see if they are able to help and provide oral care after every meal and bedtime because you wouldn't want any plaque buildup or infection to occur in the mouth of the mucous membrane. The last stage is severe Alzheimer's. They cannot communicate and they're completely dependent. Um, this has to do with aphasia, can deal with weight loss, muscle spasms, seizures, increased sleeping or restlessness, depending on how it affects them personally. And they also become incontinent with bowel and urinary systems. For the nursing intervention for this would be to combat impaired verbal communication. You would assess the patient's ability to speak. That you'd assess their language deficit and presence of aphasia, which is difficulty understanding language and communicating and formulating sentences with the thoughts that you have, because there's the connection between your brain and your mouth is almost lost at this point. And So it's more important to focus on nonverbal communication, such as body movements, pointing, smiling, face grimacing, any grunting. You need to pay attention to those because that may be the only way that they're able to communicate at this stage. You also need to almost anticipate their needs, such as you need to have meal times prepped beforehand. Um, you may just try to get them to the restroom to see if they need to use the bathroom, or if you have a bedpan, just have it nearby. Anticipate those movements based on how much they have eaten and fluid intakes. And if they are able to communicate somewhat, uh, like non-verbally, ask them simple questions. You don't want to confuse them by asking a complex question, and then hopefully they're able to provide like a nod or yes or no if they're able to speak, or a one-worded answer to help with. If we're in a face-to-face setting, I would ask the audience, which would be my classmates and my nursing instructors, if they're able to understand the topic of Alzheimer's, if they were further educated on the topic and different stages of Alzheimer's. I wish I could make this presentation longer because I love talking about it. But in a face-to-face setting, I would do that. I wish I had visuals because I wanted to show the actual deterioration of the brain because it's interesting to look at. And then at the end of my presentation, if we were face-to-face again, I would have offered a quiz which had 5 to 10 questions, just simple questions over different symptoms and what the 4 stages of Alzheimer's are, and how you can combat those at each stage as nurses. That is it, and thank you.